Malaria is one of the most severe global public health challenges worldwide, particularly in Africa, where Nigeria has become an endemic country, with the population at risk of contracting the disease. The latest malaria report from the World Health Organization, WHO, shows that there were 229 million cases of malaria in 2019, and the estimated number of deaths stood at 409,000. Now, 6 African countries accounted for half of all malaria deaths worldwide, with Nigeria top of the list with 23%, the Democratic Republic of Congo 11%, Tanzania 5%, and Burkina Faso, Mozambique and Niger with 4%. Children under 5 years of age are the most vulnerable group affected by malaria, and it remains the leading cause of death among children in Nigeria. Now, as Nigeria joins the rest of the world to commemorate World Malaria Day 2021 with the theme Zero Malaria, Draw the Line Against Malaria. Action, why has the country's prevalence rate remained high despite several measures towards tackling it? The new malaria vaccine is said to be 77% effective in early trials. Now, is this a game changer and potential breakthrough against the disease? Well, these are just some of the issues up for discussion on the program today. Welcome to the program. I am Dennis Adigbenloye. Joining us in the studio to discuss reducing malaria prevalence in Nigeria is the Malaria Program Manager, World Health Organization, WHO, Nigeria Country Office, Dr. Linda Ozor. Pleasure to have you with us on the program.
Good evening. Thank you for inviting me. Thank you.
You're welcome. Also here with us in the studio is the Head Case Management's National Malaria Elimination Program, NMEP, Dr. Nena Obulafo. You're also welcome to the program.
Thank you, and thanks for having me.
All right, you're both very welcome. Let's begin with a brief overview of malaria. How is it spread, and who are those at risks of contracting the disease? Let me begin with Dr. Linda.
So, malaria is a killer disease, as we all know, and it's contracted through the bite of an infected female Anopheles mosquito. So that is the vector that carries the parasite Plasmodium falciparum, which is the predominant parasite in our country. And so it's a dual host disease, dual host, double host, meaning that an individual has to have malaria parasite in them. Then the vector, which is the female Anopheles mosquito, bites the individual that has the malaria parasite, picks the parasite from the individual and transmits to another person who now gets infected with malaria. And this is how the spread goes on and on. So it's transmitted through the bite of an infected female Anopheles mosquito carrying the malaria parasite, falciparum, Plasmodium falciparum in our own case.
Okay, so that means that anyone who gets bitten by a mosquito is not necessarily going to contract malaria unless the mosquito itself has got the parasite. That's what you're saying?
Absolutely, sir.
All right, and who is at risk? Which groups of people are most at risk of contracting malaria?
So everyone is at risk, especially in our country, Nigeria. Everyone is at risk: the old, the young, the adolescents, teenagers, and all. Everyone in Nigeria is at risk of malaria, even though we know that there are areas in Nigeria that has higher risk based on their topography and other prevailing factors around those areas. But everyone in Nigeria is at risk of malaria.
All right, so let me bring in Dr. Nena. The figures I earlier reeled out show that Nigeria has the highest prevalence rate in Africa. Why is this the case despite several measures over the years against the disease?
So thank you. So Nigeria, I just want to also bring to bear that the population in Nigeria, we're over 200 million, you know. So that can also give, for that reason, why we have Nigeria topping the list, because, you know, we have, you know, our population is quite a lot. And also, just to say too that the topography of Nigeria, you know, gives in, you know, for a good breeding ground for the mosquitoes, you know. We have, you know, and also the weather across board, the climatic changes, change, you know, or climate in Nigeria also gives for that. Okay, so we have, you know, the rainforests. Okay, we have the savanna area. You know, so generally the eco system and the topography of the country can give to that. Okay, that does not mean that Nigeria as a country is not doing a lot to see to the reduction of prevalence in Nigeria, as it were. But, you know, that could, you know, give in for those high figures we have in Nigeria.
Yeah, I think it's a very important point you made with that. The, you know, population of the country certainly has a big influence on the stats and the rankings, if you like. Staying with you, Dr. Nena, the children under 5 years of age are generally regarded as the most vulnerable group affected by malaria. Why is this the case? Is it to do with the immune system, the environment they live in? What is the reason why 5-year-old children and below are the most vulnerable?
Yes, you're very correct. So, you know, the under 5s, like we call them, are vulnerable to the disease. Also pregnant women. So you find out that these are two groups of people that have low immunity or reduced immunity due to their circumstances. The children, because, you know, they are quite young, you know, haven't acquired, you know, that immunity through, you know. And then the pregnant women, because of their pregnancy states, you know, so it's just, you know, it's like, you know, they are prone to having, you know, that reduced immunity. Okay, so reason why those two groups are the most vulnerable across the population.
All right, staying with the issue of pregnancies, Dr. Linda, can malaria be transmitted from a mother to her unborn infants before or during delivery? If yes, what can be done to prevent this?
So typically we have what we call malaria in pregnancy. And malaria in pregnancy is, I mean, it just means when a pregnant woman contracts malaria.
Yeah.
And that is why, to prevent it, we have what we call intermittent preventive treatment in pregnancy. This involves the administration of sulfadoxine pyrimethamine to pregnant women starting from the first contact within the second trimester of pregnancy, 1 month apart up until the time they deliver, to a minimum of 3 doses. So it means if you register for antenatal care early enough and you are caught well enough into your second trimester, that's at 13 weeks of pregnancy, you would have to take at least 4 or 5 doses of the SP sulfadoxine pyrimethamine. And malaria in pregnancy is a very serious issue. I know that Nigeria estimates that about 11% of maternal mortality is caused by malaria. 11%? 11%, wow. Yes. And that's quite high. So it means that of all the maternal mortality, about 11% is due to malaria. And what does it do to pregnant women? In addition to the effect it has on the baby, the pregnant woman herself comes down with, you know, of course, malaria can lead to anemia, reduced blood in the woman's body, and so it has effects on the unborn child. And some of these effects are typified, like when you have a child and the child is of there's something we call low birth weight, when the child is small for age. So when you have a child who is less than about 2.5 kilograms at birth, you can say that child is, and it causes a lot of problems after delivery. Some of these children do not make it past the neonatal stage of age. Some of them die within the first 28 days, and some of them would have to grapple with, managing low birth weight, and also most of the women, because they are anemic and they have, the malaria in their system, they are predisposed to what we call preterm delivery, and so it means the woman is prone to delivering her baby before term, before 39-40 weeks of pregnancy, and all this predisposes the child to negative effects after birth.
Sure. And this 11% figure, is it an increase or reduction given the efforts we put in place to stem or check these cases of deaths during pregnancy because of malaria? Is the 11% figure an increase or decrease?
Well, what I would like to say is that 11% is a lot.
Yeah.
Whether it's an increase or a decrease is a lot, and it's totally unacceptable.
Sure.
For something that is totally preventable and treatable, we can save those 11% of women from dying. So why do we have to go, I think it has to be made known to every pregnant woman that they need to demand for this SPs to be given. They are very simple interventions. When you are 13 weeks pregnant, get your SPs, prevent yourself from getting malaria, have a healthy outcome at childbirth. So I think 11% is very high and totally unacceptable.
All right, Dr. Nena, given what has been happening in the last year plus now with COVID-19, do you feel that attention to this other serious medical issue has been on the wane, or what would you like to say about that?
Yes, sure. So, malaria, before the pandemic, malaria has been home with Nigeria, like I initially explained, because of our environment, So, yes, I would say that malaria, we need to go down, we need to kind of emphasize, and have, our hands more, on malaria as a disease, okay? The pandemic, it's, yes, still ongoing, okay? But malaria is something that, has killed more, in terms of, you can see the statistics in terms of cases as rolled in the last, in the 2020 World Malaria Report. We have about, just like you said, 228 million cases of malaria. So it shows that, this is it's a disease that, everybody should kind of focus on, while also dealing with the pandemics, and just to say that, malaria, the COVID-19 pandemic kind of presents alongside the same symptoms with malaria, so it's important that, emphasis are put on how we can diagnose malaria, which is, of course, with the fevers, when you have the symptoms coming on board, you need to, be able to kind of delineate between COVID-19 and malaria as a disease. And so early diagnosis is very important when you come down with those symptoms. Okay, so when you diagnose, and also early treatment is also important. So it's important when you diagnose that, and that you have malaria, then you can treat, and of course the healthcare workers are also at home, knowing that at least we know the cause of this fever, knowing very well that the COVID-19 and malaria can present exactly the same way, which is fever, and then of course the headaches, across board, the barrage of symptoms that they have all alike.
Yeah, very important to make that point. All right, we'll take a quick break now. Our program is Nigeria Today. Do stay with us. We'll be right back. Let's hear from some Nigerians on their thoughts on malaria.
Like storing dirty water can also attract mosquito. when the environment is not neat, mosquitoes will come. When the trees are overgrown, maybe in the compound you're living, and you don't keep them clean, mosquito will also come.
First of all, we may like to control the drainage, because most of the houses we have, the drainage system is very porous. So as a result of this, most of the mosquitoes, they used to hide in those places.
It is our surroundings. We need to take good care of our surroundings. Even inside your house, you need to be clean for you to prevent the whole thing of mosquito and then malaria.
Make sure we keep our environment clean. I'm also advising the government of the day to also help by sanitizing people in terms of cleaning our gutters.
All right, you're welcome back. The program is Nigeria Today. On NTA News 24, we are discussing reducing malaria prevalence rate in the country, and as the world marks World Malaria Day, we have the Malaria Program Manager, World Health Organization, Nigeria Country Office, Dr. Linda Ozo, and the Case Management National Malaria Elimination Program, NMEP, Dr. Nena Ubulafo, in the studio. Dr. Linda, you heard some of the comments from members of the public. There seems to be a general understanding of how we can prevent, on our part, how mosquitoes breed and, their breeding environments. Just give us your thoughts on some of what they said about preventive measures, and if we're really putting these practices these measures into practice as Nigerians generally.
Thank you very much. It's quite interesting to see a lot of Nigerians emphasizing on sanitation, and sanitation is key to lead a healthy life. But for malaria control precisely, we emphasize more about why you need to keep your environment clean. You also need to get rid of all the breeding sites around you. And what are these breeding sites? So malaria, the malaria vector typically breeds on fresh, clean water. And so it means that when you have water bodies like water collections from the rain, you have in your bathrooms, because of maybe sometimes people store water in buckets and leave them open either in their bathrooms, around the homes, or you have like a bottle lids that are turned over and it rains and it collects water. The flowers, it rains, there's water collection on the flowers. As little as they are pools of water that form breeding sites for malaria. And so if you have these breeding sites around your home, then you're calling for more malaria. And so you should ensure that while you're keeping your house environment clean, that you also rid your environment of those breeding sites. Very, very important. All right, Dr. Nena, let's talk about the theme for this year's World Malaria Day, which is Zero Malaria, Draw the Line Against Malaria. Just talk to us about why this theme this year.
Thank you. So, the theme, drawing the line against malaria. So, it just simply means that every one of us needs to participate in ensuring that malaria is eliminated in Nigeria, okay? And you can also, just closely related to that theme, it's the slogan, which says, stand up for action. Okay, so across board, we're saying that everybody needs to draw that line, and in drawing that line, we all need to stand up for action. So it's not just the government, while the government is doing their bit, the populace, the individuals should also be doing their bit. And what is that there? What is expected from them as individuals? So just like we heard a couple of Nigerians talking about keeping your environment clean, it's as simple as that, So me and you should know that we will keep our environment clean, okay? So because also the dirty environment, which some of us cannot be able to, it's not of our making anyway. So we're also saying that, it goes hand in hand that you should also sleep, inside the mosquito-treated nets, your mosquito-treated nets as a preventive measure. Okay, because we already have, these environments that are not that kind of conducive for the mosquito. Okay, so the preventive measures should come on board. Okay, so for everyone, especially the vulnerable population like we talked about, we should make sure that, everybody's sleeping, under the mosquito or inside the mosquito-treated nets. Okay, so that's an action for everybody. Okay, and then for us as government, as NMEP, we have a couple of interventions that we're deploying across board. Okay, so we have that, just like my WHO colleague talked about, the intervention for the pregnant women with the simple SP tablets. Okay, which you start with the first trimester, after your first trimester of pregnancy. And then, of course, we also have the seasonal chemo prevention for under 5s population, another vulnerable group that we have, that goes down with this disease. Okay, where we give sulfadoxine, pyrimethamine, plus amodiaquine as a combined, treatment to the under 5s during the peak of the rainy season. And we don't do this across board the country. There are eligible states within the country, okay, that are receiving this intervention. So part of what we're also saying to the mothers is to make your children available when this intervention starts, which is usually the peak of rainy season that starts around June, through the period of October, in the country. So this is to make sure that we have the drugs in their system, the therapeutic effect of the drugs in their system, as to prevent them from coming down with malaria. All
right. Okay, let me come back to Dr. Linda. The vector, the mosquito that transmits malaria. Some are saying it's developed resistance to mosquito nets, to insecticides, and all the rest of it. How true is that?
Yes. Yes and no, because I need to be clear about that.
Yeah.
So the malaria program, as recommended by WHO, implements what we call the insecticide resistance management plan. And that plan is, it builds in guides on how to monitor efficacy of the insecticides we use against malaria. And these insecticides are not just found in the nets. We have insecticides in that the net is impregnated with insecticide, and then we have the other intervention called the indoor residual spraying that we also use insecticides for. So to ensure the maximum effect of these insecticides in killing the parasites, in killing the mosquitoes, we conduct periodic evaluation and assessment of those insecticides. And so and this cannot be a general statement, because it has to be on a case-by-case basis. So every state, prior to deployment of nets, either through mass campaign and through routine channels, an assessment of the efficacy of those insecticides are done in those particular sites, and if found efficacious, they are deployed. We have in Nigeria seen some emerging points of resistance to the regular, we call them the regular nets. Those are impregnated with what we call the pyrethroid. That's an insecticide. And so for those areas, especially those showing some biological degradation, we recommend what we call the PBO nets. So this PBO is a substance that has additional effect in the additional killing effect on mosquitoes. So for areas that have shown resistance to the pyrethroids, we in Nigeria have now adopted the deployment of those PBO nets in those areas. So for every state where the net campaign is going to happen, the National Malaria Program, in collaboration with WHO and other partners, conducts this assessment to ensure the efficacy of the insecticide. And where it is not efficacious, the PBO nets are introduced in those particular areas.
All right, that certainly sounds very, very good, and will have the positive impact. All right, unfortunately our time is up, but I'd like to thank you, Dr. Linda Ozo, Malaria Program Manager at the WHO Nigeria Country Office. Many thanks for being with us on Nigeria Today and sharing your perspectives. Thank you.
Thank you very much.
And thanks also to Dr. Nena Obulafo, Head Case Management, National Malaria Elimination Program, NMEP. Thank you, Doctor, for being with us as well.
Thank you very much.
All right, and thanks to you out there for watching. Nigeria Today is live at 7:30 in the evening every weekday. You can also catch this and other editions of the program on youtube.com/NTA News 24 Hub. I'm Dennis Adegunloye. Thank you for watching.